Hello, everyone. We are from small group discussion B5, and we would like to present about human immunodeficiency virus or HIV in adult in order to complete our task in the health system-based practice block. We are consisted of 12 people, which is Kirana, Dio, Ayu, Widya, Kylie, Cassandra, Adelia, Karina, Yuma, Juven, Justin Lordia, and Justin Amori. These are our outlines for today's presentation, which is consisted of 3 chapters. Chapter 1, background, Chapter 2, contents, Chapter 3, conclusion. And we will begin to explain about the Chapter 1.
Hello, my name is Stephen Fianto with the student ID number is 091. I will continue about the introduction. HIV is a single-stranded RNA retrovirus that causes immunodeficiency syndrome, or AIDS. HIV can be transmitted via sexual activity, blood transfusion, intravenous needle, mother-to-child during birth, and breastfeeding. The clinical symptom varies between individual and none of the symptoms are specific to HIV. This is due to the other infection by other organisms such as other bacteria, virus, and fungal. HIV is one of the global major public health problem. In 2017, there were 48,300 individuals infected with HIV in Indonesia. 2,441 of them were located in Bali. Hence, this paper discusses about the role of family and family medicine for the holistic approach of HIV. Next.
Hello everyone, this is Emery. My last 3 digits of the ID is 081 and I will present about the problem formulation and the objective of this presentation. So the problem formulation consists of 8 points. What can be found in the analysis from patients with HIV? What can be found in the physical examination from patients with HIV? What are the additional examinations can be done patients with HIV? What are the risk factors of HIV? Is there any interaction, especially HIV? How does the HIV impact the patient family? What are the roles of family medicine approach to identification of HIV? And what is the prognosis of HIV? And the objective is the same with the goal of formulation, when analysis findings from patients with HIV, knowing the physical examinations of HIV patients, knowing the additional examination in patients with HIV, understanding the risk factors of HIV, understand the family interaction, in spreading of HIV, understand the impact of HIV to the patient's family, understand the roles of family medicine approach to identification of HIV, and knowing the prognosis of HIV. That's all from me. Thank you.
My name is Karina with student number 2002-511003, and I will explain how to do an anamnesis to a suspected HIV infected patients. As with other cases, physicians should ask the basic 4 and second 7 questions, but adjusted to the patient's major complaints and conditions. Most of the time, patients infected with HIV came to the clinic with presenting opportunistic infections as mild as oral candidiasis and as severe as lung TB and Kaposi sarcoma, and with general complaints like fever, breathing difficulty, coughing, diarrhea, and rapid weight loss. Little present illnesses questions regarding the symptoms are needed to be adjusted to the patients, such as questions about the onset, locations, quality, quantity, factors influencing the symptoms, and patient's attempt to alleviate the complaints. Following present illnesses, the interview delves into past medical history, including congenital or hereditary diseases, allergies, and specific questions related to HIV/AIDS, such as previous complaints, blood transfusion, drugs, and substance abuse history. Social history explores marital status, sexual history and relationships, cultural and religious views, which may or may not impact the patient's health risks. Physicians must emphasize the sensitivity of some questions and the importance of establishing a trusting doctor-patient relationship early on. HIV/AIDS holds stigma and relates to fear of discrimination in Indonesia, urging physicians to educate not only the patients but also patients' social circle, family, and wider community about the disease. That is all from me. Thank you.
Hello, my name is Justin Lordialin. I'm going to continue our presentation. I'm going to talk about the physical examination. So HIV infection does not have specific physical findings to confirm the diagnosis. However, some acute viral syndromes might present. Some of the most common are fever, adenopathy, rash, and oral ulcers. Physical findings of certain infection or illness may be clues to HIV infections. Patients may experience weight loss, and it is also common to find generalized lymphadenopathy. Some concurrent opportunistic infections that are common that can be found in HIV-infected patients are candidiasis. Candidiasis, especially oropharyngeal candidiasis, is really common in people with HIV. White plaques adhering to oral mucosal, buccal mucosal, gums, palate, tongue are signs of oropharyngeal candidiasis. Herpes zoster ophthalmicus. HIV can cause the reactivation of varicella zoster virus, and it can involve trigeminal nerve causing herpes zoster ophthalmicus. The patient may feel loss of vision, pain, photophobia, and retinal detachment. Seborrheic dermatitis. Present as erythematous scale lesions of the scalp and face, and hypopigmentation can be found around it. Toxoplasma encephalitis. Patient may experience headaches, fever, confusion, ataxia, hemiparesis, and cranial nerve deficits. That's all from me. Next.
Hello, my name is Mandi Kirana Chandra Putri, with the last 3 digits of my student ID number is 168, and I'm going to tell you about additional examinations. So there are various tests to help diagnosing HIV, including NAT, antigen, antibody test, and also antibody test. So the body produces antibodies in response to infections, which detected by antibody test in salivary blood. HIV is typically detectable from 23 to 90 days post-exposures through antibody testing, while an antigen antibody test conducted 18 to 45 days after exposures can also identify HIV. The nucleic acid test, analyzing methods like polymerase chain reactions, monitors HIV infections, and also the response of antiretroviral therapy by identifying viral nucleic acids. Early HIV testing is crucial to cut the spread and also reduce the prevalence of HIV. That's all from me. Thank you.
Hello, I'm Madi Aikunitat Maja with student number 216. I will explain about the risk factors of the patient's disease. So HIV risk factors encompass structural, behavioral, and also biological elements. Poverty, migration, urbanization, gender disparities, and violence heighten vulnerability. Risky sexual behavior, such as multiple partnerships, transactional sex, and age-disparate relationships, contribute significantly. Physiological changes in the genital tract and factors like STIs and intravaginal practices increase susceptibility by facilitating viral entry. Genital tract inflammation in women with STIs may upregulate HIV-susceptible cells, potentially aiding transmission. That is all from me. Thank you.
Greetings, I'm Dio and my student identification number is 133. Individuals with HIV undoubtedly faces numerous stresses, which include family-related concerns. HIV stigma not only affects those infected, but also their families, impacting relationships both within the family or outside the family. This can be especially true for children with HIV or HIV parents. Monitoring family dynamics can anticipate responses to HIV disclosure. And with effective communication, it can minimize negative reactions to the disclosure themselves. Proper family support can also aid in addressing common comorbidities in HIV patients, one of which is tuberculosis.
My name is Loputi Widyamrita Devi with last digit number 002. I will continue the presentations about identifications of the disease impact to family. AIDS resulting from HIV infection is a chronic and stigmatizing disease with a poor prognosis. Beyond the individual, it places a significant burden on partners and families, provide physical care and emotional support, leading to potential stress and tensions within the family. The impacts to the in family could be seen in 4 aspects. The first aspect is in the aspect of couple or family relationship. family member or partner is diagnosed with HIV, and this results in the disclosure of a person's behavior that they may wish to keep secret. This may eventually result in feelings of guilt, blame, and cause damage to relationships between partners or families. That's all from me. Thank you.
Hello everyone, my name is Kylie with the last 3-digit number is 114, and now I'm gonna continue the second, the third, and the fourth aspect. So the second, in the aspect of economic, family members or partners are diagnosed with HIV may increase the family's economic burden for treatment costs, which can result in increasing emotional and financial problems. The third one, in the aspect of morale, stigma and discrimination regarding HIV disease can result in diagnosis being kept secret. This can hinder wider support from the extended family or community. And the fourth one, in the aspect of health. The stress of living with HIV causes some people to suffer mental health problems such as anxiety and depression. For me, that's all from me. Thank you.
Hello, my name is Ketua Adelia Febrianti Puspadewi with the last 3-digit of my student ID number is 041. So I would like to continue the presentation with identification of family medicine approaches. So HIV substantial impact on families, particularly in research-limited settings, adds strain to already stretched public health system. Many of HIV patients face challenges with families struggling to accept the situation, often due to the lingering stigma. HIV-related stigma remains as a barrier to treatment that causes patients to feel guilty and also face rejection. Family doctors, serving as a primary care providers, play a crucial role in detecting, preventing, and caring for HIV patients. Family-centered approach prove the most cost-effective and also suitable for addressing HIV challenges that emphasizing family involvement in patient care. Counseling is also essential for the patient itself, families, and also community that support HIV patients for a better quality of life. That's all from me. My friend will be continued the next part.
Hello everyone, my name is Cassandra with my last 3 name digit is 152, and I will continue about the prognosis of the disease that is HIV. So patients with HIV and a CD4 count above 500 have a life expectancy similar to those without HIV. Untreated AIDS reduces life expectancy to 1 until 2 years after the first opportunistic infection. Antiretroviral treatment or ART boosts CD4 counts, transitioning from AIDS to HIV status. For those on ART with high CD4 counts, life expectancy is only slightly lower than the general population, regardless of when treatment begins. Early diagnosis and sustained treatment remain crucial for individuals with low CD4 counts at the start of follow-up, emphasizing the importance of timely intervention. That's all from me. The next part will be continued by my friend. Thank you.
My name is Karen Maksmadewi with student ID number 200251189. I will continue the presentation about conclusion. HIV is a single-stranded RNA retrovirus that transmitted through various means. Suspected HIV patient often present with opportunistic infection. Key interview questions include the Secret 7 and Fundamental 4. Establishing a trusting doctor-patient relationship is crucial for honest communication. While HIV lacks specific physical finding, signs like herpetic lesion or weight loss may suggest infection. Diagnosis examination include NETs, antigen antibody test, and antibody test can be done. Risk factor for HIV involve structural, behavioral, and biological elements. Genital tract inflammation may aid transmission in women with STI. HIV stigma affect patients and their families, emphasizing the need for open communication to avoid negative responses. The disease impacts family dynamic economically, morally, and health-wise. Family-centered approach prove cost-effective, involving family in patient care. Counseling is essential for patients, families, and communities to support HIV patients for a better quality of life. The prognosis of HIV depends on CD4 count and treatment. CD4 counts above 500 yield a life expectancy similar to those without HIV. Untreated
untreated AIDS reduce life expectancy to 1 until 2 years after the first opportunistic infection. That's all from me. Thank you.
Okay, so that marks the end of our presentation, and these are our references. Thank you for watching. We hope our video will give you more information and comprehension towards HIV in adults. Thank you.